Pharmaceutical giant Pfizer, they're working with researchers at NYU to develop a vaccine that they say could be ready as soon as this September. And experts have said that a reliable vaccine is the only safe way to reopen the economy. But President Trump and others say we simply cannot wait that long. It's becoming a thin line between health and wealth.
We're opening up our country again.
By the end of this week, at least 42 states will ease coronavirus restrictions. But at what cost? According to one model, the nation's daily death toll will double to nearly 3,000 a day if states reopen too soon. When asked by ABC News today if lives are being put at risk for the sake of reopening, the president acknowledged it's possible there will be some deaths, but also added,
we have to get our country back. You know, people are dying the other way, too. When you look at what's happened with drugs, it goes up. When you look at suicides, I mean, take a look at what's going on. People are losing their jobs.
Even former New Jersey Governor Chris Christie is weighing in.
And they're going to be deaths no matter what. We've got to let some of these folks get back to work, because if we don't, we're going to destroy the American way of life.
How many deaths and how much suffering are you willing to accept to get back to what you want to be some form of normality sooner rather than later?
But a dire warning from Dr. Anthony Fauci. Fauci is a key member of the White House's coronavirus task force, a task force led by the vice president that Mr. Trump said will soon be winding down.
Mike Pence and the task force have done a great job, but we're now looking at a little bit of a different form, and that form is safety and opening, and we'll have a different group probably set up for that.
The disbanding of the task force, another sign the nation is moving into another phase. The president pushing for states to reopen amid a raging debate. Should we balance the cost of lives to restore the American way of life?
The faster we reopen, the lower the economic cost, but the higher the human cost, because the more lives lost. That, my friends, is the decision we are really making.
And the Pfizer-led project is one of numerous vaccines that are currently in human trials, but experts have warned that to get a vaccine in less than 18 months is being overly optimistic. The normal development time for any vaccine is several years. We're live on the East Side tonight. I'm Shirley Chan, Pix 11 News.